A new project which is SCAN, and it's a survey of challenges in access of diagnostics and treatment of NET patients. So the committee is beside myself, is Mark, Christine, Suganda here, and of course Theodora and Christina. What is it exactly? Well, it's split up in two questionnaires. One is based on patients itself, and the other one is based on healthcare professionals. And we will translate it in 10 languages, just the same as the other things in English, Spanish, Italian, Arabic, German, French, Japanese, Mandarin, Hindi, and Russian. Why are we doing this? We're going to map the availability and of course also the cost price of the diagnostics and the treatments for the NET patients worldwide. We're going to measure the awareness and the level of understanding, not only the level of understanding of the patient, but also of the healthcare professionals. What are we exactly going to measure? It's, are you being misdiagnosed? Which types of diseases have been wrongly diagnosed? The timing to the right diagnosis, which is often a very long period, your net grade. And then mapping of the specialist, because like Mark already spent, we believe that with a rare cancer, you shouldn't go to your GP or to just one other oncologist, go to a specialist. In Belgium there is even now, the government is now thinking of making it mandatory to go to centers of excellence, to expertise centers, and do not mix around anymore with the local hospital. What else is awareness? Who is visiting the specialist? Because even in our small group of NET patients, we see that some of these just go to their GP. They're a member of our organization, so they know they got NET, and they are being treated by their GP and by some doctor in a hospital. I think that is very risky. I also believe you cannot expect that GPs are fully aware about every rare disease. There's plus 8,000 rare diseases in the world. If everybody is going to have, let's say, 15 minutes for it, then it takes a few years more studies. Doesn't make any sense. So centers of excellence, I think, is very important. Also, how far are these centers of excellence or these expertise centers away from where the patient is? Some patients have to travel international. Some patients can go with a bicycle to the hospital. Of course, also, how much is it going to cost? And then we mean what is going to cost out-of-pocket expenses, not what is the invoice. Because if the insurance pays it, it's still available. But if a treatment of a PRRT, for instance, will cost 100 or 150,000 US dollars, I wouldn't consider it as available in a country, for most people at least. So how are we going to do this? The survey must be, of course, statistically reliable. We have the chance that Christine has a lot of experience in statistics, and we can also use some of the basis of our unmet needs survey. We will also use soft quotas because we can't really pinpoint how many responses we will get out of the questionnaire. But we will spread it around all over the world. And we need, of course, help of all our members. And I would kindly ask also our sponsors to spread the word that there will be this survey. It will also benefit you, I think. The survey should not take longer than 15 minutes. We're still working on that. We skipped a lot of questions, dumped them because they were redundant and whatever. But at the moment, we are now in the last stage, and I think next week over we will make an appointment and then finish it and then start with the translation. Who are we going to reach? Of course, the NET patients worldwide, healthcare professionals worldwide, and then all medical professionals involved in multidisciplinary teams. There is no such a thing as a NET specialist. It's not an official title, but it's the one we will feel. You know, my oncologist is a NET specialist because he treats several NET patients, and he's working in a center of excellence. It will be difficult. We have to figure out how we're going to do the naming. I think we just make a footnote what it will mean. Like I said, we're asking, once it's ready, we will send out a message, and then we kindly ask you to promote it. In Belgium, for instance, we're only 6 million people speaking Flemish. We're not going to translate it. The cost will be too much. But what we did is we planned with our members to sit together, and then we will online translate it and run through the questionnaires. That's about it. Any questions?
You mentioned about the referring patients to specialists, and also this questionnaire is geared toward all medical professionals. We always have a question about who's the net specialist. Is there any definition that we could rely on? Is one question. Another thing is like you have Center of Excellence. I wish we did, but we don't. So how should we target this questionnaire to? So those two questions. Specialist. Definition of you said that. Yeah.
There is no ruling about who is a net specialist. It's not an official academical title, but we would go that if you treat several patients, and at least when you're working in a center of excellence, not necessarily the ENET center of excellence, but in a specialist center who's treating nets, then I would consider you as a net specialist. And the other question was?
We don't have Center of Excellence, so any cancer treating hospital would do about the medical professionals. Oh, I see. You mentioned that at the Center of Excellence, it may not necessarily be for net, but if there is a doctor there who sees net patient, few of them, that will qualify. But in Japan, they will ask me how many patients would qualify those doctors. So if you have any ideas, I appreciate any.
No, the answer is no. We have to define this in the access group. But it doesn't have to be a center of excellence. In Spain, there are no centers of excellence, but there are very well-renowned net specialists. It's just Center of Excellence is a name of ENET.
If I may add, something we've considered, because there's no definition in stone for a net specialist for sure, and I appreciate the opinion of our experts here. But having a series of patients for sure, but also having undergone some sort of certification or some sort of specialized courses into neuroendocrine tumors is something that would qualify the expert as a net specialist.
I just wanted to touch briefly on that. The ENET is actually, it's a very nascent stage at which we are working on, but the ENET's advisory board has got this net specialist concept also in mind, and probably we will kind of define a curriculum to train the normal patients, doctors, about all different aspects of the neuroendocrine tumor patient management. It's a very nascent stage, but it's a very valid question. How do you call a net specialist? So we are working on that from the ENET side.
Well, one of the solutions could be is do you consider yourself a net specialist, and then how many net patients do you treat? But we haven't worked that out yet.
I think that's a good way to do it, because you're going to have very few people that are going to say I'm a net specialist and not actually see, no one's going to self-describe themselves. It's not such a popular area that people are going to want to describe themselves. So you could self-identify. Are you experienced in nets, or do you feel comfortable treating patients with nets? And I think the vast majority of people would self-identify correctly. The only thing you may want to keep in mind for your survey, what we're struggling with is, in our province in Ontario, it's very big geographically, is do all patients need to travel so far? Or are there some cases, for example, somebody has a very small lesion in the rectum that is incidentally found, that can be removed locally, that they don't need to travel or take time off, or at least, or even if there's a more complex case, they can get some of their care closer to home. Some can be at the center of excellence. Like, you may want to look at that in your survey as well to see that, like, does every visit have to be at the center of excellence if it's not close to your home? Yeah. And how could you share that care? Maybe the GP doesn't know about the rare cancer, but can be educated so that they can at least be a part of the treatment, so that the patient, easier for the patients, so they don't have to go traveling all the time.
Well, one of the things is like in the hospital where I'm treated, they have now a network, which means the patients can go to their local hospital, but the report will always be sent to the medical team in the center of excellence. So, and the doctor you're seeing is actually just the radio between the MOC and the patient. On the other side, if you have neuroendocrine tumors, I think a good scan would be appropriate, and that will not be in one of the academical hospitals in the small villages. Christy.
It is not a question. I just would like to add, this is a worldwide survey. So we need to combine every organization in every country. For example, we had problem to qualify center of excellence, center of reference, public hospital, university hospital, regional hospital. So it's quite difficult if we want to have the right answer and to qualify the answers. We need to combine all countries in the survey.
Obviously, some countries are very spoiled with centers of excellence or reference centers. Others, other countries other patients will have to leave their country and make some serious traveling.
So one of the things, I think what Dr. Singh said is very important, that many doctors will be reluctant to just call themselves, sorry. Okay. So when you're taking the survey, one of the interesting thing that if the patient can answer or the clinician side can answer is, are there different specialities who will be able to deal with this disease? Because naturally, NET patients will be requiring sometimes nuke med, sometimes surgery, sometimes endocrinologist, more often than not a super trained pathologist who can actually identify the NET. So I think those are the questions. Will they have an access to that answer? Would they even know about it? Or do they have to now go to another hospital or another place? So in one place such as in Toronto or in Quebec City, you would be able to find different specialists in the same place who have been treating, and historical data would be available. Would the patients know about it if you ask them this question, or will you only get it from the other side? So
I think asking the question is answering it in this case. Yeah. No.
Because I think you should really ask, because this is one disease where you really, it is not just breast cancer, but it is something where it will require different specialists at different stage of the disease. So if that is available,
Yeah.
that's the best place to go. If a pathologist is unable to identify the tumor, not every run-of-the-mill pathologist in every hospital will be able to even understand what they are looking at. But if you go to these centers of excellence,
But probably,
you will know right off.
but the patients who have NET and are not identified as a NET patient will probably not join.
That's it, yeah.
So,
If you can probe that.
yeah. Anybody?
I would be interested in the access and affordability part of your survey. Yes, I would be interested in the access and affordability part of your survey, and because there's a lot of work happening now in patient organizations, in patient communities around access and affordability and pricing. Would it be possible for you then to come together with these other organizations and share your experience and become part of this conversation? Because it would be interesting to see also your data, your input, so that we can coordinate this more on a European and on a global level.
I would love to. On the other side, we have a deadline to catch because Theodora is already looking angry at me. But yeah, I would love to. If we can help each other, why not? Yes. So we keep in contact about that. Thank you.
Just give some time.
Well, the definite version, we just discussed it briefly. We will send, Christina will send the last versions. We do some homework and then we have a telephone call latest by end of next week. I'm sorry, I can't make myself free earlier than that. And then that was the case, so then we should be ready with the definite version before the translators go into holiday, because that's the next threat which is on the pathway. How long would the translation take? Do you have any idea? Yeah. Well, it must be ready before Net Cancer Day. Definitely before. Yeah.
Is this going to need any institutional review board for approvals? Yeah, institutional review.
Thank you very much. I'm very interested in how the data are going to be published and the results. What are they used for?
We're not going to keep it secret.
No, that's what I. That's
I'm done. I'm done, Madam President.
Elaborate on how do you think this data will be beneficial to different, so for example, the medical community, to the patient and to pharmaceutical industry. You think it helps?
Yeah, definitely. One thing is to make NET patients aware that there are other and better possibilities, so they can start complain and contact. On the other side, it's like PRRT is not in every country available, and then the question is why. In Belgium, it's still officially not refundable. Officially, they found another way around it to do this, but it will motivate the patients. It will raise the awareness with the healthcare professionals because they get these questions, and we're also sending out the survey to general practitioners, GPs. So even if he hasn't seen any NET patient in his life, it will still trigger something at least. But it's more. I think that the biggest benefit is to make NET patients aware of what is available in other countries, and then kick the lower butt side of their government to get it.
Yeah, we would like to use this information as an advocacy tool, so to map where the gaps are and what's available where, and to empower our members, but also communities from outside the INCA membership to go to their governments and ask for the optimal care and access possible. That's the whole idea behind. There's going to be a paper, obviously. There are going to be report cards, again, ideally in several languages. Obviously, that's going to take more time, but our target is to have the initial results ready prior to Net Cancer Day, because access would be our key theme for this year's awareness campaign.